Good evening. Welcome to the 2024 annual meeting of the American Society of Tropical Medicine and Hygiene. My name is David Hamer, and I'm the chair of the Scientific Program Committee. We're happy to have you all here in the Bayou with us this week, and we promise you a great meeting. We've done a lot of work to prepare for it. Associate Scientific Program Chair Christy Murray and I, along with the 151 members of the Scientific Program Committee and our hardworking ASTMH staff, have been busy throughout the year to assemble you for an exceptional gathering. During the next 3.5 days, we hope you'll have the opportunity to attend a variety of sessions covering a broad range of topics, from research and basic sciences to clinical updates to reports on improvements in program operations and topics of concern to international members, students, and trainees. In addition to plenary speakers presenting every day, we have 3 special sessions planned on Marburg virus in Rwanda, but it's a little bit more than that. It's really CDC response to pandemics, avian influenza, H5N1, and then Mpox. And you can find all these listed in the meeting app along with all of the other sessions, speakers, and abstracts. The app is free and available for download from the App Store and Google Play. And just one little thing about the app, when you click on a session or a speaker, you might just see the first person, the speaker, but below that there's a little sign that says more. Click on more and it gives you all the speakers and all the information about the session. So I'd like to thank our sponsors. So we have, actually here we go. So first of all, we have over 4,000 attendees, pushing 4,200 to 4,400 at this point in time. In person, as well as some that will be seeing this through our live stream sessions, which is really just one room in the convention center. All together, we represent over 100 countries, and it's with your contributions and willingness to share your latest insights that we were able to put together this informative program that you're all about to experience this week. But before I introduce our host for the evening, I would like to acknowledge our generous sponsors, supporters, contributors, and friends of the young investigators. Their assistance helps to make this annual meeting a success. So these include the Bill and Melinda Gates Foundation, Drs. Mark and Cindy Cortepetrer, Pfizer, Takeda, the Malaria Foundation International, the Center for Malaria Therapeutics and Antimicrobial Resistance, at Columbia University Irving Medical Center, Global Health Labs, and Parasites Without Borders. In addition, Friends of the Young Investigators with William A. Petrie Jr. in honor of William A. Petrie Sr., and all individuals who made a donation during registration throughout the year. Additionally, we'd like to thank the Borough's Welcome Fund, the International Association for Medical Assistance to Travelers, the famous Star Institute of Management and Technology, our partners at CZI BioHub San Francisco, and our contributors eMed and Core DX. In addition, as shown on this slide, we're grateful to have 8 sponsored symposium partners hosting 9 sessions this week. This is, I think, more than we've had in previous years, and we appreciate the assistance of Abbott, Bavarian Nordic, Bayer, U.S. Crop Science, the Bill and Melinda Gates Foundation, BioMérieux SA, IVCC, Medicines for Malaria Venture, Vestergaard, and United to Beat Malaria. These sessions are taking place outside of the scientific sessions tomorrow morning, tomorrow evening, and Friday morning. And finally, I'd like to remind everyone that outside of the scientific sessions that we have the exhibit hall, where there will be many organizations, and this is a list of all the different exhibitors that include many organizations and companies that support tropical medicine, ASTMH, and all that we do. Please take some time to visit them and learn about their newest services and products starting tonight at the opening reception, which will immediately follow this session. The reception will begin right after the award ceremony in the convention center, and just follow the crowd when we exit after the award ceremony. So now it's my pleasure to introduce ASTMH President Linnie Golightly.
Thank you so much, David, and welcome to everyone here. I'd like to acknowledge, and I hope you're all going to join along with me in acknowledging the wonderful leadership that David has had in terms of bringing together what is going to be a fantastic program. He and his Associate Scientific Program Chair, Christy Murray, as he mentioned, did so much hard work along with an intrepid committee that reviewed all of the fantastic contributions that you all have brought to this meeting, and of course, our outstanding staff. We don't want to forget all of the hard work that they do and many others that we'll be talking about and acknowledging along with this during the time of this meeting. So could we give it 3 cheers? And now I'd like to welcome you, my friends, my ASTMH family, new members, old members. Some of you have never heard of us before, but by the time this is over, I hope you'll know how dynamic a community that you have come to meet with here this year in New Orleans. And I hope you'll get in the spirit of all the things that we attempt to do worldwide. As many of you know, these were not the original dates for our meeting. There was someone named Taylor Swift, and I was notified that although we usually plan our meetings 5 years in advance, we were going to have to quickly pivot and get out of the way of a whirlwind. We did send Ms. Swift her greetings, but I do have to say this, that I admire, and I think that we have some things in common with her, in that she represents in the young people that follow along with her so many facets of the world, and many of those same facets are here in this room. And also the belief that the youth have so much to contribute. So I think that we have solidarity and bonds of friendship, even though it was a little hard to make arrangements. Some of you may have noticed that you kind of had to walk and walk and walk and walk. I hope you figured out that there's a way to do that inside through the mall. Did people figure that out? Yeah, did some of you just take an Uber? But I hope that you'll get those steps in as you enjoy all that we have here. And so with that, though, I have to say that move, we got a lot of help from the City of New Orleans and our colleagues at Tulane, and in particular, the School of Public Health and Tropical Medicine and Hygiene that's helping us with hosting this week. Can we give a round of applause for them? And as you know, New Orleans is a place of lore for our community. The history of epidemics in New Orleans led to the establishment of the first School of Public Health and the first School of Tropical Medicine in the United States. And if you're interested in learning more, there are a number of multiple walking tours taking place here in the city. Now, don't be missing out on too many of those awesome scientific sessions, but in between. But we do have things going from morning to late in the evening, and again, I echo David's call to take a good look at all of the things that are available here. And so now, it is my great pleasure to introduce our keynote speaker. And as she comes to the stage, I'll give you just a few words about Dr. Monique Wasunna, who is the Drugs for Neglected Diseases Initiative's Africa Ambassador. In her current role, Dr. Wasunna engages African policy leaders and other stakeholders to support their ambitions of advancing universal health coverage, treatment access, and eliminating neglected diseases through R&D collaborators that deliver new treatments for the most vulnerable patients. Previously, Dr. Wasunna served as a regional director of DNDi, Eastern Africa. She also was chief research officer and assistant director of research at the Kenya Medical Research Institute, and served as the director of the Center of Clinical Research, KIMRI, and subsequently as acting director of KIMRI. She was a member of the International Bioethics Committee of UNESCO and founding chair and member of Leishmaniasis East African Platform, which promotes clinical research and strengthens research capacity for leishmaniasis in the region. Dr. Wasunna is a physician and an infectious disease and tropical medicine specialist. She holds a Bachelor of Medicine and a Bachelor of Surgery degree from the University of Nairobi, as well as a master's and PhD from the London School of Hygiene and Tropical Medicine. She also holds a diploma in tropical medicine and hygiene from the Royal College of Physicians of London. She has been recognized for her contributions to neglected diseases research and for her dedication and service to neglected communities. She is a recipient of the Distinguished and Neglected Tropical Diseases Researcher Award from the Kenyan Ministry of Health and the National Order of Merit from the French government. Additionally, She has been honored with a Collaboration and Partnership Award from the Kenyan Medical Research Institute and was named a mycetoma ambassador. Dr. Wasunna has been a researcher and a principal investigator in visceral leishmaniasis, malaria, and HIV studies. Her career embodies what we do here at ASTMH, leverage the best of science and medicine to tackle some of the world's most neglected health challenges. In choosing a keynote speaker, I thought long and hard, and though there are many, I think you will agree with me that tonight we are truly honored to have Dr. Wasunna. Dr. Wasunna. And before she begins, we will hear a brief video.
Neglected patients live in very remote areas and they are very poor. You're in the shadow. Nobody knows about you. You're not even in any statistic because nobody knows you exist. Patients suffer in silence. I first heard of neglected diseases when I was really a young doctor working for the Kenya Medical Research Institute. We had so many patients suffering from these neglected diseases. Doctors in the field don't have treatments, and if treatments are there, they're toxic, they're not easy to use, they're ineffective.
Dr. Wasunna.
Good evening. It's lovely to see you. The room is full. It's amazing. A big thank you to Dr. Linnie Golightly, President of STMH, Jamie Bay Nishi, CEO of STMH, and STMH Board for this once-in-a-lifetime opportunity to give Keynote, STMH Keynote 2024. I never in my wildest dreams thought I would be standing in front of a crowd, an audience like this. So I'm really honored. I want to acknowledge all the early scientists, researchers, especially from Africa, who are here. It's so amazing that STMH is engaging with you all. And this is very much one of the topics that I'm going to cover today. My journey into science began when I was in high school in Uganda. My father is Ugandan, my mother is Rwandese, my husband is Kenyan. I'm truly an East African. My class of medicine school of 1990 had only 19 girls and 64 boys, the largest number seen during my time. Still a drop in the ocean. But I was determined to become a doctor from the age of 18. Because my younger sister, Hope, had measles which presented with complications. She was admitted in a hospital in Mbale town in Uganda, together with my mom. The doctors told my mom not to expect Hope to survive. My mom was so sad, so distraught, and so helpless. During visits with them at the hospital, I did not like the look on my mother's face, and the way she was very sad. I would work, I said to myself, I never want to see this again. I would work very hard and become a doctor. I am just an ordinary African girl, and today I'm a researcher and a medical doctor. After many years at the Drugs for Neglected Diseases Initiative as the Regional Director for Eastern Africa, I am now DNDi Africa Ambassador. Today, I want to share some of my experiences with you and how they link with a larger picture of research in Africa in the context of colonial and post-colonial Africa. The story of research in Africa in colonial times was one of exploitation. The images you see here really speak for themselves. One is of white Europeans conducting a lumbar puncture to test for sleeping sickness, a disease I will talk about later. This procedure can literally kill the patient. Look at how casually, without care, this is being done. At this time, researchers were really more interested in finding treatment for cows, but not the people, because cows were a more important source of income. Parachute research was the norm. Researchers flew in, did research, took knowledge, published data in the global north, and got their promotions. Extractive research with no benefit to the locals. Also, with really unclear ethical standards or guidelines, and Africans were often used for experimentation. I want to share the quote with you from the first president of Kenya, His Excellency Mzee Jomo Kenyatta, following independence in 1963, who said, "We have shaken off the colonial yoke, but we are still faced with enemies of ignorance, disease, and poverty." End of quote. We as a continent still had so much to do. Tropical diseases were taking millions of lives, including malaria, cholera, polio, yellow fever, and neglected diseases. But we did not have the tools, infrastructure, or staff to deal with them. African countries had to set health priorities for their people, but also faced with brain drain as many African doctors trained and stayed in the global north. I want to talk about how Africa was to recover and reset from all the years of colonialism and kick the African scientific renaissance. From 1970 onward, African governments and researchers set in motion scientific renaissance. Africa, the sleeping giant, started to wake up. I'm happy to say I witnessed this. I was part of this. Graduating from University of Nairobi Medical School in 1990 and joining the Kenya Medical Research Institute in 1983, I want to cite two key components of this renaissance. One, the development of best practice for research excellence, and importance of partnerships. Scientists began to develop research on diseases affecting the most vulnerable. You can see me here checking on a patient with mycetoma at the Mycetoma Research Center in Khartoum, Sudan. Bona, who leads this, is here. The middle photograph is of my colleague, Democratic Republic of Congo, Dr. Wilfried Mutombo, who has been working on finding safe treatment for sleeping sickness for many years. Ethics and regulatory committees were also created to oversee research to protect participants. As a member of the Institutional Ethics Committee and Scientific Steering Committee at the Kenya Medical Research Institute, I helped evaluate research proposals for scientific merit to confirm safety of study participants and credibility of data to be collected during clinical trials. Cultural sensitivity was paramount. I want to tell you a story why. This is the logo for the Kenya Medical Research Institute, KEMRI, a water tower with a snake coiled around to the top. The logo is on all KEMRI vehicles. We used a KEMRI vehicle to travel 300 kilometers away from Nairobi to a region where visceral leishmaniasis was endemic. We were working on a diagnostic proposal for visceral leishmaniasis. The study required the collection of urine from participants and then boiling it. A small amount of blood was also collected. Sorry. After the first day, there were no more participants willing to be part of this study. Why? Local villagers thought the logo meant that we were devil worshippers and that the blood we were taking was being fed to the snake. Granted, it was our mistake. We fixed it in long discussions with the village elders and the community. But it taught us one important lesson, that community engagement from the get-go is essential for clinical trials to work successfully. To include community on advisory boards, in governance, and on ethics review committees. I want to talk briefly about the African research institutions that began to spring up in the 1970s to address diseases affecting the most vulnerable, like neglected tropical diseases, malaria, TB, Ebola, and so many more. African governments were really taking things seriously, investing in education to build scientific capacity as well as developing research, health research priorities, and encouraging exchange programs among scientists and medical students. I benefited from such programs. At the London School of Hygiene and Tropical Medicine for MSc and PhD programs, gained lifetime skills. To push for strengthened scientific African leadership has been key to our success. And today, we have many more research institutions than this. We have come a long, long way. The other pillar of African scientific renaissance is partnerships, which continue to be so important today. I'm sure many of you benefit from it too. Partnerships between South-South, like India and African countries, focus on training healthcare workers, like Brazil's support to Madagascar for TB and malaria research, and partnerships between African countries on sleeping sickness, malaria, leishmaniasis, and many more. There was also a change in North-South relations. As I mentioned, I also benefited from this. My master's and PhD studies were thanks to the World Health Organization Special Program for Research and Training Tropical Diseases. It blew my mind away to be exposed to scientists from all over the world. It made me inquisitive, seeing how labs were run in the north, but knowledgeable about tropical diseases. Professor Keith McAdam, some of you know him, he was my supervisor. He believed I knew everything in tropical medicine. How refreshing. I came back to duplicate what I found and to give back to my community. Spending my early career at the Kenya Medical Research Institute, learning research, and eventually becoming an acting director and a CEO of the institution. It was while I was a chief research officer and director, Center for Clinical Research at Cambridge, that I joined a meeting organized by Doctors Without Borders, MSF, invited along with colleagues from other low and middle income countries to discuss how, together, we can create a new initiative to focus on drugs for neglected diseases. This would become my professional home for many years, because it was a place I could put my passion into what my heart wanted to do most. That is to find treatments for the most neglected patients and visceral leishmaniasis. I think many of you know Drugs for Neglected Diseases Initiative. In 1999, MSF received the Nobel Peace Prize and used some of the money to create DNDi, and was joined by 6 other public institutions to focus on diseases affecting the poorest of the poor. This photo was taken on the 1st of July 2003 when DNDi was created, and I was there. You can see me in the purple dress, the African dress, and today again I'm in purple. It's a coincidence though. But I do see and recognize Dr. Diana, who is seated here, and she was there too, and she's here. Many of the colleagues you see here have since retired, but I am still there. I still have a lot of work to do. On the second photo, you see me on a panel at the first scientific meeting in London, at the LIPS first scientific meeting in London. It is such a memorable photo for me because my African colleagues presented at an international scientific meeting, some of them for the very first time. I want to turn now to a few DNDi success stories and how these relate to the theme of presenting decolonizing science for the benefit of all, the marriage between community and science, and how this has borne fruit in the form of treatments we needed so urgently. Those I will talk about today are my passion: visceral leishmaniasis, malaria, and sleeping sickness. First, visceral leishmaniasis. This man in this photograph is called Luke. Luke, when he was 14 years of age, he was treated for visceral leishmaniasis with antimonial compounds, sodium strobogluconate, or SSG. It has very serious side effects, affects the heart, the bone marrow in high doses, but it was the only option for dying patients. We needed a new treatment that was safe and efficacious. The study you see here compared sodium stribogluconate and paromomycin for 17 days to sodium stribogluconate for 30 days. We did this in 6 clinical trial sites in Ethiopia, Kenya, Uganda, and Sudan, and showed that the combination treatment was just as effective as the monotherapy arm at 91%. Not only that, it required a shorter duration, a shorter stay. It was cheaper, less toxic, and produced fewer side effects. The World Health Organization Leishmaniasis Expert Committee recommended this treatment regimen in 2010 as one of the first-line treatments for visceral leishmaniasis in Eastern Africa. Eventually, all 4 countries adopted the World Health Organization guidance, changed their national policies, and revised their visceral leishmaniasis guidelines. Today, Luke is a nurse, and he worked in the hospital where he was treated, treating patients with the combination treatment. Our studies continue, and together with other partners, we are on the cusp of delivering an all treatment for visceral leishmaniasis. Once this happens, then I will truly retire. Secondly, malaria, not a neglected disease, but something we felt we needed to do because the monotherapy antimalarials were becoming ineffective due to resistance. In 2001, the World Health Organization recommended the use of artemisinin-based combination therapies, ACTs, but these therapies were not available. Through public-private partnership with Sanofi Tech, others, we developed artesunate amodiaquine, AZAC, a combination treatment for uncomplicated falciparum malaria. More than 550 million treatments delivered so far in 33 countries. The access component of this project was handed over to Medicines for Malaria Venture for continued implementation. This photograph on your right is of my colleague, Dr. Wilfried Mutombo, who has also worked in sleeping sickness, which is the last example I want to share with you. Thirdly, the sleeping sickness. Until the years 2000s, the only treatment for sleeping sickness was an arsenic. Arsenic-based derivative called malaceprol that killed 1 in 20 patients. It was so painful that the patients described the treatment as fire in their veins. Can you imagine? Fire in their veins. One of the colleagues in the Democratic Republic of Congo, Dr. Victor Kande, has said there is nothing more painful for a doctor. There's nothing more painful for a doctor than to cause death of a patient. There's nothing more painful for a doctor than to cause the death of a patient. He became a lead researcher in the search for cure that did not kill. Working first on a hospital-based infusion called NECT, then fexinidazole, and a 10-day oral treatment. It's a 10-day oral treatment that became available in 2018. Today, we have an all-oral dose called acoziborole, developed by DNDi, Sanofi, and partners, including the Bill and Melinda Gates Foundation and communities in Guinea and DRC. This slide shows Dr. Mariam Kamara a researcher from Conakry, Guinea, holding an acoziborol pill for sleeping sickness, the dream of every doctor who has ever treated this disease, and which will play an important role in eliminating sleeping sickness for good. Of course, treatment is just part of an integrated approach to elimination, being undertaken by a range of players, which includes screening, vector control, diagnostics, working with communities, ministries of health, providing political will and leadership, and much more. Our role is to develop treatments. The results of acoziborol have been published in The Lancet, and they are incredible. Treatment success rates of up to 95%. The goal is for acoziborol to be available to doctors working in the remotest villages, so that elimination can be truly achieved. This is the first time a disease would be eliminated by a pill, not a vaccine. This would be a tremendous victory for African science, for a disease that bears the name African sleeping sickness. For all the three diseases I've talked about, malaria, sleeping sickness, and visceral leishmaniasis, we have learned some important lessons. That partnerships between scientists, communities, and governments is key to success. With malaria, the work of community field workers was critical in gaining acceptance of the artesunate-amodiaquine combination treatment. With our visceral leishmaniasis treatment, governments quickly adopted the new treatments thanks to early engagement and results dissemination. With acoziborol, trials were led by national control programs with African expertise in the driving seats. The African experts in the driving seats. It takes trust, equity, partnerships, interdependence, communities. It takes all of this to make sure that what we study in the lab reaches the people that need it most and saves and improves lives. However, all these lessons were thrown aside during the COVID-19 pandemic. This begs the question, was the response to COVID-19 pandemic another form of imperialism? The world went back to business as usual. Science benefited the rich. Collaborations and best practices were put aside, and people in the global south suffered as a result. According to the Nature magazine, 1.3 million lives were sadly lost in the global south because of vaccines were not available or were not shared. There was vaccine hoarding, vaccine nationalism, vaccine apartheid, and when South African scientists shared their knowledge of new COVID-19 Omicron variant, as soon as they discovered it, they were punished for it. With South Africa facing travel bans, alerting the world to scientific discovery. All of us in Africa were horrified. I have to smile here. This is my friend, Dr. John Kengasong. He was the ASTMH 23 keynote speaker. Dr. Kengasong referred to injustices of the response to the COVID-19 pandemic in this way, and I quote, "As a continent, when this is all over, and it will be over, we are a resilient continent. We will remember not just the loud voices of those who did not support us, but we will also remember the silence of our friends in this battle." This includes silence over not just COVID-19, but our lack of access to vaccines for Mpox, health technologies for HIV. These headlines speak for themselves. This kind of iniquity has to change. What is the point in making scientific discoveries that saves people's lives if people cannot access them? What is the point? Things will change thanks to a new era of public health and scientific leadership, including Africa CDC leading the way in setting health and research priorities for the continent. Earlier this year, Africa CDC Director General declared Mpox a public health emergency of continental security and started leading the response. A powerful example of health and scientific leadership on the continent. Also intending that 60% of Africa's vaccines to be produced in Africa by 2040, so that we don't face the same kind of vaccine inequities I talked about earlier. They are also developing hubs and opportunities for more clinical trials to be led by Africans for Africans, so we can take control of our own destiny and achieve the Africa we want through the African Union's Agenda 2063. As I conclude, looking ahead to decolonize science to benefit all, we will get there if we remember the importance of these points. This tree signifies the growth of science on my continent. All the factors we need for it to flourish, so that we can create a future where science can truly benefit people, everyone. A future where science is truly decolonized. Funding reform, respectful and action-oriented partnerships, community involvement, political will, and the one that's important to me is the involvement of more women and more young people in science. Let me end by saying this. My father believed in the education of all his children, especially his daughters. And that's why I'm standing here today. And today we have so many African women and youth becoming researchers, doctors, and scientists, like those you see in this slide. Like those of you who are here today from Africa. Where are you? my brothers, my sisters, younger sisters, and my younger brothers, my daughters and sons, you are the future. Let those of us in the older generation support you. I am where I am today because somebody supported me. Let those of us who have been around a while support the young colleagues to do what we can do to lift them up, to connect them with peers from across the globe. You are all here from all over the world. Let's connect the young people to you. Let us be their shoulders to stand on. Let us all be each other's keeper. Let us all, no matter our race, our age, our country of origin, embrace the importance of community, of partnerships, of making sure science reaches the people who need it most, and to be part of decolonizing science to benefit all. I wish you all fruitful deliberations in the next few days. I will still be around and look forward to taking part in some of the sessions, and will interact with many of you, especially the young scientists, the young researchers. DNDi and MSF have a booth in the next few days. You'll find me there, and we can continue this conversation. I thank you. Thank you. Thank you.
I told you she was dynamic. I'd like to thank you for a wonderful, not only talk, but history love lesson and a challenge, and one I know that we are up to. I actually earlier this evening had the pleasure of meeting with our students that are here present. Give a shout out if you're a student. With some of our young investigators who came and presented. Give a shout out if you were in that competition. And I want to tell you, now she just told you could come by and find her in our hall, so I want you to do that. But I'd also like to give her something of our appreciation. From our society to you. Thank you so much. Now, for those of you that are worried about pictures, we do have an expert photographer here. Can we give her a cheer? And we had formal photos taken in advance to try to kind of decrease the time of this program. So, with her inspirational remarks, I would like to remind you that we do have some other talks that are coming up. And so we have several plenaries. But things happen. We know how the world is, and many of you have seen some of the terrible things that have gone on in Haiti. And so Dr. William Pop will not be able to join us. I've told him that he is in our thoughts and prayers. As you know, he is a beloved member of our community and has worked in Haiti for many years through many dire circumstances. And this is a new and much more difficult challenge. However, as a family, we do have people who step up and step in. And so a member of our board, Dr. John Amwusi, John, give a shout out, give a wave, is actually going to be presenting in his place as our commemorative lecture. And I ask you to please come and also join some of the other speakers that you will be hearing. They will all be awesome, as well as the rest of our program. So now we enter another phase of our program, our celebration of excellence. And we have much to celebrate and many members in our community to celebrate. I think it's particularly fitting that we follow Dr. Wasunna's talk, someone who spoke of her journey as a woman in medicine and science, with the Mwele Malasela Mentorship Program Award for women in neglected tropical diseases. She was an inspirational figure, a dedicated leader, and a committed listener, something we were just told was very important. She was a director of WHO's Department of Control for Neglected Tropical Diseases when she passed, unfortunately, away in 2022. In addition to her role with WHO, she was Director General of the National Institute of Medical Research for the United Republic of Tanzania, the first woman to occupy the position, and was founding director of the National Lymphatic Filariasis Elimination Program. The Mwele Malasela Mentorship Program for Women in Neglected Tropical Diseases supports mid-career African women to become leaders and champions in NTD elimination at national and international levels. The two-year program provides mentorship, training, and networking opportunities for cohorts of women. With us tonight is one of the women who is part of this program, Christine Wanjala. Dr. Wanjala is standing. Now, please do give her a round of applause. Now, Dr. Wanjala was supposed to be sitting next to me, so she could be greeted by Dr. Wasunna. Dr. Wasunna, could you stand up again? But a certain past president, Julie Jacobson, Julie, I believe, had her sit next to her. But if we could all see, as we can see, two dynamic women, a dynamic duo, and I congratulate you and all of the other winners of this award, or part of this program. Thank you so much. So ASTMH is proud to support the journeys of many global health professionals across so many specializations, geographies, and stages of their careers. On their way, these journeys are supported through our annual meeting travel awards, and we have many. Some of these are for our early career professionals. A travel award from the ASTMH presents them with an opportunity to attend this conference. I took a picture with an awful lot of them. Can you guys give a wave? Where are you? Reach over and shake a hand. And so they're coming, many for the first time. I have to tell a secret. I stand here because I came here not knowing anyone. I came to a meeting in Hawaii. I'll talk about that a little bit later on one of my own talks, but it changed my life. I met my tribe. I met my people. And so to all of our travel awardees, I hope that the participation in this meeting serves as a foundation for your future as well. But we have many supporters that enable this type of travel, and I'd like to mention them now. The Bill and Melinda Gates Foundation, the Malaria Foundation International, Parasites Without Borders, and all of our ASTMH subgroups, as well as the ASTMH at large. And many of you may have given a donation when you registered for the meeting this year. So our Young Investigator Awards that I alluded to earlier. The Young Investigator Award recognizes the work of young researchers and encourages developing scientists to pursue careers in various aspects of tropical disease research. This afternoon, before this opening plenary, the Young Investigator Award applicants presented their research to a panel of judges. And now, I will announce the results of that judging to you. Now, this is hot off the presses, you see. So, if you could please stand when I call your name. Alonso Cruz Echevarria from the Universidad Peruana. Now, you know, they didn't get to give me all of this in advance. Cayetana Heredia, Peru. Abigail Goodship, Imperial College of London, United Kingdom. Cheney Kalinich, Yale School of Medicine, United States. Michelle Marti, University of Pittsburgh, the United States. Chastity Trammell, Colorado State University from the United States. Sean Yannick from Johns Hopkins, United States. Pedro Cecilio from the NIH, United States. Elizabeth Fusco. Elizabeth, are you out there? I hope you guys are standing up. Indiana University School of Medicine, the United States. Beatrice Martin from the University of Queensland, Australia. Ejioma Okoye, Drexel University College of Medicine, United States. Millicent Opoku from La Trobe University in Australia. And Andrew Teo from the Lee Kong Chian School of Medicine in Singapore. A round of applause for all of them, please. And I did get to meet all of them. We also have some honorable mentions, which I'd like to name. Afsana Afrin from the International Center of Diarrheal Institute at Bangladesh. Sean Connolly from the University of North Carolina, United States. Monica DiCola, Imperial College of London from the United Kingdom. Arena Diekman, Washington University School of Medicine, United States. Nugent Zhang, Oxford University Clinical Research Unit from Vietnam. Anna Winicki from Case Western Reserve University of the United States. Round of applause for all of our winners. All right, I thank you so much, and for all of our judges that helped to make this possible. Okay, I'd also like to thank our corporate sponsors for the Young Investigator Award. Without them, this, of course, couldn't be possible. William A. Petrie Jr. in memory of William A. Petrie Sr., and all individuals who made donations throughout the year for this award. Could we give a round of applause, please, for them? Judging was also held today for the ACC-TMTH Clinical Group Research Award. This award recognizes excellence in clinically oriented research presented by a student or a person in graduate medical school at the annual meeting. Clinical research is, as you know, a component of medical and health research intended to produce knowledge valuable to the understanding of human disease, preventing and treating illness, and promoting health. As I mentioned before, the judging took place earlier today. And as I read off the name of each recipient, I asked them to stand, again, hot off the presses. This year's recipients are Teresa Sepulveda from Baylor College of Medicine. Please stand. Helen George from the Bernhard Nocht Institute of Tropical Medicine in Germany. And third place, Mary Ellen Owings, the Tulane University School of Public Health and Tropical Medicine and Hygiene. Those are our three winners. Would you please stand again? Give them a round of recognition. And I certainly hope that you will take the time to reach out to them and ask them something about the work that they did. We have many other fellowship and grant recipients. They're offered all year round. We have various grants that are offered by our subgroups and business meetings. They'll be offered during this week. So on the screen, I'd like to have a few of these awards are projected for you. There are many of them, and as you can see them all, there's a list of our awardees, which we will have. So congratulations to the award winners for our ASTM fellowships and award recipients. Now, some of you may be wondering, how do you apply for these awards? I guess I should go through these, I'm sorry. These are our Berkeley Borough's Welcome Fund Awards. Jamie, am I on time? Okay. Do people know about Jamie Bay-Nishi, our fabulous new CEO? She's there in the front. Can we give her a round of applause? She is an all-stars all-star. And I think you're going to agree that she's been working and having a great meeting here. So we'd like to thank you and our numerous committee chairs and committee members who volunteer their time and work to make all of these programs possible. The Society relies on all of you and your work that you do, and we appreciate all that you do. And anyone out there wondering, how do I apply for these awards? Well, you can check out our website, take a look, And then you can see and perhaps join one of our subgroups that are meeting all during this meeting. So, next I would like to talk about our borough's Welcome Fund and ASTMH Postdoctoral Fellowship in Tropical Infectious Disease Awards. A special thank you to the borough's Welcome Fund for supporting the careers of our scientific community for many, many years. This unique fellowship supports the career development of scientific physicians focused on infectious diseases in the developing world. Well done to this year's recipients. Emily Evans, please stand. Jesse Ross, Salhal Thahir. Please reach out and give a hand of congratulations. Next is the Donald Krogstad Award, an early career award for a Malian scientist. I, as many of you here, knew Dr. Krogstad. I always look forward to seeing him at these meetings and miss him dearly. This year's recipient is Nuhum Diallo. Nuhum, can you please stand? And will you please come join me on the stage? As he's stepping up, as I mentioned, I knew Dr. Krogstad, and he was a dedicated ASTMH member and past president of this society and a long-term professor at Tulane University. The fellowship was started in his name in 2021 by the family of Dr. Krogstad to support an early career scientist in Mali who is pursuing research aimed at blending laboratory and field epidemiological studies. Dr. Diallo is a research scientist at the Malaria Research and Training Center, University of Sciences, Techniques, and Technologies of Bamako, Mali. I would like to present him now with our Krogstad Award. Dr. Diallo. Next, I would like to present our Alan J. McGill Fellow. Our 2024 McGill Fellow is Poonam Amratia of Tanzania. Please come join me on the stage. A member of ASTMH since 2015, Dr. Amratia is our award winner. Created in 2016 by the Society's board in partnership with the Bill and Melinda Gates Foundation, the McGill Fellowship honors the life, example, and legacy of Alan J. McGill. Dr. McGill, as many of you know, was a deeply respected leader in the global tropical medicine community who passed away in 2015, a year after serving as a beloved president of ASTMH during one of our prior meetings in New Orleans. The McGill Fellowship provides $50,000 in funding for up to 2 years to one recipient from an LMIC. These funds support mentorship, career and leadership development for projects in tropical medicine to fellows who are in their early to mid careers. An important part of the career journey, of course, is leadership and mentorship, sharing insights and lessons for the next generation, and pursuing excellence and accomplishments in medicine. Dr. Amratia. So, in mind when we're thinking about all the many achievements, I'd like to talk about demonstrating outlasting leadership and impact in the global health community. So, the Society would like to acknowledge the 2024 Fellows of the ASTMH. We recognize these members for their sustained professional accomplishments in tropical medicine and related fields. This is a high bar set by the Society, and Fellows of ASTMH in recognition is open only to Society members. Will each Fellow please stand as I read your name? Some of them might not be here, as they have let us know about travel delays or other logistical hurdles. I ask that the audience please hold their applause until the end. Hosea Mima Akala, Matthew Aliota, Lyric Bartholomew, May Chu, Maria Duke Vasseur, Karen Gorleski, Kasturi Halder, Eric Halsey, Manuel Ginhas, Christy Murray, Kyle Peterson, Dylan Pillier, Bobby Pritt, David Saunders, Maggie Sikukulurd, and Sharon Tennant. Are they all standing? Can we congratulate them? Thank you for all of your hard work and your commitment to tropical medicine and hygiene. Next, I would like to ask that Dr. Diane Worth join me on the stage. She is the head of our committee that chose this year's Distinguished International Fellows. Some of you may know that I have an affiliation with Diane in that she was my mentor. And it was at that meeting that I attended where I decided that this was my tribe that I looked over and I saw all these people. And they just happened to be a member of her lab. And I went to her and she took me in, and I'm glad that she did. Diane Worth.
Thank you, Linnie, and congratulations on being president to my mentee. I'm very proud. So, the ASTMH Distinguished International Fellows formally recognizes up to 8 individuals who have made important contributions to a particular aspect of tropical medicine or global health. Each has made seminal contributions over their career. The Distinguished International Fellows typically acquire these accomplishments over several decades of work. And hopefully I have a slide, but I also have a crib sheet. I am very pleased to recognize the 8 fellows that have been chosen for this year. I would ask each of the fellows to stand. I think most are here. We can hold, as with the fellows of the society, we'll hold our applause until the end, but we'd like to recognize each of them. So the first is Kaku Poku Arsonte from Kintampo Health Research Center, Ghana. The second, Mauricio Barreto from Fiocruz Federal University of Baja in Brazil. Christopher Drakely, the London School of Hygiene and Tropical Medicine. Faiza Jahan of the Aga Khan University of Pakistan. Claudio Lanata, Institute Investigation Nutricional, Peru. Joel Tarning, Mahidol, Oxford Tropical Medicine Research Unit, Thailand. Antoinette Chefu Katoto, Kinshasa School of Public Health, the Democratic Republic of Congo. And our wonderful keynote speaker, Monique Wasunna, Drugs for Neglected Disease Initiative, Kenya. Please, congratulations to these distinguished members of our community.
Thank you, Diane, and again, congratulations to all of our distinguished international fellows. Our next honors are medals that are awarded by our subgroups. Each of these awardees will be honored during their subgroup's respective business meeting later this week, when the full details of their accomplishments will be provided. Tonight, though, I would like to announce the winners and the medals that they are receiving. You may find more information about each of our honorees at the QR code shown on the awards ceremony program. As I read your name, please stand, and I ask the audience to hold their applause until the end. Our first subgroup award is a Henry Hoogstraat Medal, awarded to the Society's subgroup ACME, the American Committee of Medical Entomology. Dr. Hoogstraat was recognized as one of the world's best-known authorities on tick-borne diseases. The medal recognizes outstanding lifelong service to medical entomology. This year's Hoogstraat medalist is Marcelo Jacobs Molina of Johns Hopkins University. Congratulations, Dr. Lorena. Am I ahead? I am getting a wave. Am I ahead or behind? I'm ahead. Go back. Here. Okay. I'm going to hold. You see, that's why you have to have an excellent CEO. Okay. So our next awardee I'd like to mention is we have the William Traeger Award for Basic Parasitology, awarded by the Society's subgroup, ACMCIP, the American Committee of Molecular, Cellular, and Immunoparasitology, and named for the 1979 president of ASTMH. The medal recognizes a fundamental breakthrough in molecular, cellular, or immunoparasitology. The 2024 Traeger Award is being given to Sebastian Laurito from MIT and the Whitehead Institute for Biomedical Research. Congratulations, Dr. Laurito. Could you please stand? Our next honor is the Martin S. Wolf Mentoring Award, awarded by the Society's subgroup, ACC-TMH, or the clinical group. Dr. Wolf was a pioneer in tropical medicine and traveler's health and a founding member of the Society's clinical subgroup. He also served as its first president. The award recognizes outstanding achievement in the field of clinical tropical medicine. This year's Martin S. Wolf Mentoring Awardee is Thomas Nutman of the National Institutes of Health. Dr. Nutman, please stand. And finally, the Scherer Hardy Award, presented by the Society's ACME's ACAV, the American Committee on Arthropod-Borne Viruses and Zoonotic Viruses subgroup. The award honors William F. Scherer, the 1981 president of ASTMH, who is known for his incredible research, and also James L. Hardy, a respected research scientist, teacher, and research leader in arbovirology. The award is presented to an outstanding graduate student in arbovirology. The 2024 Scherer Hardy Award is being presented to Jean-Paul Carrera of the Gorgas Memorial Institute of Health Studies in Panama. Dr. Carrera, please stand, and congratulations. Can I get a round of applause for all of our winners thus far? And now, I can press the clicker for this one now. Our next award is our Communications Award. Layla Colborn and Jamie Bay-Nishi are coming to the stage, and they will be presenting this year's Communications Award.
Good evening. The Communications Award recognizes the excellence in tropical medicine, storytelling through the written word. Communications Award entries are judged on their ability to enhance the public understanding and appreciation of tropical medicine, research, clinical practice, and/or policy. Judging is done by a panel of ASTMH members and global health communication professionals.
This year's award-winning entry is entitled "A Spiking Fever, Long Neglected, Lassa Fever is Surging in West Africa. Researchers want to know why." Written by Leslie Roberts and published in Science last February. Part history, part mystery. Leslie takes readers along a journey to understand the history of Lassa fever research and the efforts underway to understand why cases are on the rise. Leslie isn't here with us tonight, but she recorded this very brief remark and note of advice for all of us.
With anti-science sentiment running so high, I think it's important for all of you to try to engage with the public. People are intimidated by science, but if you can convey the big picture, they will get it, and they'll see how your work is improving lives around the world.
I think we'll all agree that her remarks are apropos for this time. I think we'll also agree that they dovetail very nicely off of what Dr. Wasunna said. And I know that we're up to the challenge. We have to take all that we know and speak to people, talk to people. We don't have to dumb it down. And you know how to do it. I know. You kind of helped me along the way. And the younger will help the older, and we'll all get through this together. But we do have to communicate. And a lot of great communications are going to go on in the next few days. So I'd like to thank Jamie and Layla. Could they please give a round of applause, and for an absentia to Leslie Roberts. And now we come to our society awards, our society medals. And so in this case, I am going to ask that you take a good look at the QR codes for more details about our incredible award winners. For brevity's sake, there are not going to be any acceptance speeches, but I do ask you to look out and reach out to each and every one of these very distinguished members of our societies. They are the highest awards that can be achieved. So the first one is the Ashford Medalist, Dr. Andrew Asman, who is a recipient of the Bailey K. Ashford Medal. A pioneering physician in the treatment of anemia, Colonel Bailey Kelly Ashford helped establish the School of Tropical Medicine in Puerto Rico, where he organized and conducted a parasite treatment campaign against hookworm. The Ashford Medal, distinguished work in tropical medicine, and this year we actually have two, I should say, medalist winners. So one is Dr. Asman. Dr. Asman, can you come and join me, of Johns Hopkins University in the United States? Again, you can find details about his achievements, but briefly, he's being honored tonight for his work on cholera and other infectious diseases that leverages his engineering, biostatistics, and epidemiology degrees and provides a platform for training the next generation of ASTMH members. His work has improved the health of large global populations at risk for cholera, and his commitment to global public is highly deserving of this Ashford Medal. Our second Ashford Medal recipient this year is Jonathan Giuliano. Please come and join me, of the University of North Carolina at Chapel Hill, the United States. Dr. Giuliano is being recognized for a commitment to high-impact, rigorous science and his capacity building throughout Africa, most notably in the Democratic Republic of Congo and Malawi. He also leads the Infectious Disease Epidemiology and Ecology Lab, a consortium of faculty at the University of North Carolina and several other universities, including the Imperial College of London, Brown University, and the University of Florida, among others. Please help me in congratulating him. Our next award is the Clara Southmaud Ludlow Award. This is the first society-level medal award to be named after a female icon in tropical medicine. Dr. Ludlow was an entomologist and the first woman member and first non-member of our society. In that non-MD member of our society. In that same spirit, the Ludlow Medal recognizes male and female honorees for work that represents success despite obstacles. This year's Ludlow medalist is Firdausi Quadri of Bangladesh. Please come and join me. She's receiving this award due to her determination and strength of spirit, which are all consistent with that of Dr. Southmaud. Dr. Quadri lives by the saying that anything is possible in Bangladesh. If she can dream that something should happen, she will do everything that she can do to make it so. This includes creating a new research NGO dedicated to the development of science and technology in Bangladesh, the Institute for Developing Science and Health Initiatives, a thriving organization involved in research, infectious diseases, that goes beyond just infectious diseases in tackling other important health problems for Bangladesh. I should say she's also very involved in training the next generation of our scientists and physicians. Congratulations. Our final award tonight is the Walter Reed Medal. For those of you who don't know, Walter Reed was a U.S. Army doctor and pathologist who led the research that proved yellow fever is spread by mosquitoes. The Reed Medal is the Society's highest honor. It is awarded each year to recognize distinguished accomplishments in the field of tropical medicine. We'd like to give a thanks to Drs. Mark and Cindy Porter-Peter for their generous sponsorship of the Walter E. Reed Medal again this year. This year's Reed Award Medal winner is Dr. Steve Hoffman. Please come join me on the stage. The list of Steve's scientific discoveries and accomplishments speak to his unwavering commitment to and leadership of tropical medicine. During 2 decades of military service, he reported on plague parasites of refugees, lymphatic filariasis, dengue, cholera, typhoid, fever, and malaria. 2 decades ago, he founded Scenaria, Inc., which has gone on to conduct over 40 clinical trials in North America, Europe, Africa, and Asia. And he substantially contributed to this society. As president in 2001, and through his leadership of the clinical subgroup, where he conceived and implemented the Ben Keene Medal, Keene Traveling Fellowship, and the American Committee of Molecular, Cellular, and Immunoparasitology subgroup. In collaboration with former President Michelle Berry, he also helped establish our Certificate of Knowledge in Tropical Medicine and Traveler's Health. It is for this life and much more that we are proud to honor Stephen Hoffman with our most prestigious Walter Reed Medal. Please thank me and congratulate me. It's been a wonderful evening. We've paid tributes to many, and there's a party to come. But before we leave tonight, we have to acknowledge that there are some that we have lost. We've lost Michael Kwiatkowski, whose trailblazing work in malaria genomics will be honored with a special tribute session hosted this week by the Bill and Melinda Gates Foundation. We've also will have tributes to 3 of our past presidents who we've lost within the last 12 months, Joel Brennan, Carl Johnson, and Kent Campbell. We also lost a true advocate and friend of all that we stand for and work for, First Lady Rosalind Carter, who along with President Jimmy Carter were pioneers working together with us, and who we had their legacy captured in September in a supplement to our journal, and you can take a look at that. But how do you pay tributes to those that are lost? How do you carry on? How do you move forward? I like to think about the Sankofa bird, that you learn from them, you keep your feet forward, and you keep marching. But there are many cultures, many other ways that people pay tribute. And so I ask you to come to these various tributes, and also there may be other people that we've lost. We actually have a wall where you can go with a little push pin, put up a note, and then we all can know who we've lost in our community and remember them and go forward. But we are, of course, in New Orleans, and they do have this thing called the second line. Has anybody ever heard of one of those? Yeah. Well, if you don't know, you're about to learn. And what a second line is a way of rejoicing and celebrating. You may do it at a wedding, or you may do it at a funeral, or we're going to do it here as the ASTMH to honor our past. And so I think there's a band out there. Are they coming? And that's the second line. And in the New Orleans tradition, what you do is as they come by, we're going to follow them, and then we're going to go to a hall where I understand there's a wonderful party. And I don't have to say I understand it because I've come many times. It's a great place. There'll be food. There'll be fellowship. Please stand out and join a hand. Go visit some of our many sponsors' booths. Get a little food and have a little fun. And so if the line is ready to come, we can all follow them on out of the hall and have a great time. I thank you again for coming to this meeting. I again look forward to meeting many of you and to seeing you next year, where we will be in Toronto. But before we get there, have a good time in New Orleans. Thank you all.